We're seeing GLP-1 work better for some patients than others. Could you break down how gut health, inflammation, and hormone balance might be affecting your medication success? What hidden roadblocks are you finding in your practice? Well, for one, when you are trying to lose weight and you are solely focused on using a GLP-1, then more than likely you did not get to the root cause of what was holding you back from losing weight, and you're putting yourself up so that you are more than likely going to gain the weight back. So in functional medicine, what we do is we want to try to get to the root cause and see, okay, what else is happening inside of the body that is affecting this person from losing weight. So when we have someone that come into our clinic and they said they tried a semaglutide or Wegovy, or they even tried tirzepatide and they really didn't lose weight, that's a signal to say, okay, then there was other factors that was holding you back from losing weight. And a lot of times, because some of these other factors are not addressed, this is the reason why you have patients who are on high dosages of these GLP-1s, because you're not focused on other things. So when we talk about hormones, that's some of the things that we look at. So we want to look at your hormones and make sure that your hormones are at optimal levels. We want to make sure that your androgen hormones are at optimal levels, because androgen hormones, cortisol levels, etc., because these things helps to assist the body. It helps with, one, for someone who may be exhibiting eating due to depression or anxiety. These androgen hormones can help with that. These androgen hormones actually help you to burn fat, build muscle. It helps with the immune system. Estrogen is very important, as well as progesterone too, because not only are these hormones important, just people think because, oh, a woman doesn't have her cycle, or it's just there for your cycle. It's important because if it's not at a certain metric or number, you can put on belly fat too. You can have problems sleeping at night, and we all know if you're not getting a good night rest, that's going to lead to a whole bunch of problems, and definitely you can have issues without losing weight, because the body is not resting, where those cells are not rejuvenating the way that they should at nighttime. Then we want to talk about like gut health, right? So we know that, well, in functional medicine, we know that the gut is also associated with your gut makes GLP-1. So that's a signal that actually, if it's working, it helps you to burn weight. And also, your gut has certain neurotransmitters, actually more neurotransmitters in your gut than you actually have in your brain. So those same signals that say, oh, the reward or treat, or you feeling happy versus you feeling sad, if we haven't worked on your gut, then that can hold you back from losing weight, especially having a slow digestive system, having SIBO. I've seen H. pylori, you name it, leaky gut. It's so many layers to this. So yes, hormones can hold you back. What was the other question? Gut health can also hold you back. Certain medications can definitely hold you back, just because certain medications have its own side effects, and depending on what it is, it can have an effect on certain organs in the body. And I mean, or it can affect certain nutrients, minerals in the body that can help you to lose weight, help with certain things as far as like your urine input. So sometimes you could be experiencing edema and holding on to water weight when we need to address certain things like your electrolytes. So we look at the whole body when it comes to you losing weight and you being on the GLP-1. Like I said, it's just a tool. Guys, it's a tool to kind of get you started, to quiet the food noise. So if you are someone that have high insulin level, or you are someone that is have high blood sugar level, it helps so that it can actually help bring those metrics down. But to say is that if you haven't tapped into those other things, then more than likely you will gain the weight back. and that's something that you're spending your money, you're investing time. So why not do it the right way, right? Why not get to the root cause, and why not get the body like functioning? I kind of look at the body almost like a car. You want to get the engine all revved up and running and going, and you want to make sure that it's good. So each time you crank up the car, that engine is like running and good. And that can happen. Age doesn't have anything to do with it, because there are older people that can get in the gym, that can outwork, women in their 20s and their 30s and their 40s, because why? They take care of the temple, the body, the hormones, the gut. So all of it plays a factor. These are all the things that we look at in functional medicine when we are helping you on your weight loss journey. Many believe GLP-1s are the complete answer, but your approach combines them with functional medicine. Walk us through how addressing root causes like thyroid function, cortisol, gut microbiome, as well as health can enhance these medications' effectiveness. So, for one, combining functional medicine to most things, you are going to get a better outcome due to the testing that we can do to see like what's happening inside of the body. Sometimes if your cortisol levels are not right, like you can feel so tired and exhausted. It can keep weight on you. There's a such thing as called cortisol face, where your face starts to look puffy. Cortisol is huge, because cortisol, when it's not where it needs to be at, it can cause so many problems inside the body, as well as inflammation. Now, if we're talking about thyroid, I've seen at times where the thyroid as well as cortisol levels can also be linked in together too. Thyroid helps with the metabolism. Thyroid, if certain measures are too high, too low, you can gain weight. There are some forms of issues with your thyroid where you can actually start losing a lot of weight. So we definitely want to make sure that your thyroid is functioning the way that it should. It has the proper nutrition to help with the thyroid. So I like to look at the full panel when we're doing thyroid. So looking at your TSH, your T3, T4, seeing how like your thyroid is firing. But also I like to ask questions, because sometimes you can do lab testing on thyroid and it doesn't show you a true reflection of how that person may be feeling. So you want to take into account what your client or your patient is saying, or what you're saying to your doctor, how you're feeling, because like I said, you can test sometimes, and sometimes, especially like if you're taking like biotin and things like that, you will not get a real reflection on what the thyroid is doing. But thyroid is huge when you're trying to lose weight. We want to make sure that we're constantly giving the thyroid support, but also for brain function, because like I said, the thyroid and cortisol levels too can kind of go hand in hand. And then as far as your gut, gut is huge, because if your food is not digesting, you're having gut inflammation, it's going to change how the body is breaking down food, or heck, you can even have low stomach acid, and that's a whole nother issue in itself. But the reason why we look at the gut, because when you're trying to lose weight, women who have PCOS, right? So that particular hormone in itself, most people don't know if someone has PCOS, not only do you need to address the PCOS, but you also need to look at and see what's happening with the gut, because there's a lot of gut issues that's associated with PCOS that most people aren't looking into. So like I said before, there's so many things that could be going on with the gut. SIBO, leaky gut, H. pylori is on the rise. A lot of people don't even know they have it until we start doing all of these tests and we see all these different conditions. There's different types of tests that we can do, different type of like urine testing, GI mapping testing, that can tell us like what's happening with your gut. But that is a missing piece of the puzzle, because I feel really bad when people say, oh, well, go to the gym and work out, or you're not working out a lot, or maybe if you stop eating, you'll lose weight, or just take this phentermine pill and you'll drop the weight. Okay, but what are you doing? Like, what are you doing to assist, to kind of see like what's happening in the body, to assist these people in losing weight? I invest a lot of knowledge and training in how I'm going to assist my community, especially women, Black women too, when it comes to losing weight. So I met with the top obesity doctor, and these are some of the topics that comes up, as far as the way that people who are overweight are being treated, but with the proper testing is not being done to even assist. So yes, as you guys can see, I take this very serious. But yeah, I look at all of those things. All of these things are very important. So if you are on a GLP-1, if you're on semaglutide, Wegovy, or tirzepatide, Mounjaro, Zepbound, all these many different names, and you're not seeing the type of results that maybe your friend is seeing, or the type of results that they're saying that you should see in these studies, then there are other things that I would say that you should request to have looked at, and which is going to be your hormones. Also take a look at your gut health. Thyroid is, I think that's just like number one, that most places will look at your thyroid to kind of see, and there are qualifying questions too, to see if you're even qualified to take a GLP-1. Like, we take our clients through these questionnaires with our nurse practitioners. So, it's a lot that's involved in this process to make sure that we are putting you up for success, so that you are, having a good weight loss journey.